Vienna, 1846. The General Hospital's maternity division is split into two clinics, a few doors apart from each other. Women arriving to give birth don't get to choose which one they're assigned to. Admission alternates by day. And yet everyone in the city seems to know something the doctors won't say out loud. One of these clinics is killing its patients. The first clinic is staffed by physicians and medical students. The second is staffed entirely by midwives. In the first clinic, somewhere near 1 in 5 women who give birth will die within days, burning with fever, in agony. In the second clinic, the death rate is a fraction of that. Women know this. Some beg on their knees to be assigned to the midwives' clinic instead. Some, on the day they're due, choose to give birth in the street outside the hospital rather than walk through the first clinic's doors. And their odds, giving birth on cobblestones with no medical care at all, are still better than the odds inside. No one can explain why. The prevailing theories blame bad air, overcrowding, or the general moral character of unmarried mothers. None of it holds up under scrutiny, and none of it stops the dying. In July of that year, a 28-year-old Hungarian physician named Ignaz Semmelweis takes a post in the first clinic. He isn't looking to overturn medicine. He's looking for an answer to a question that somehow nobody in the building has been willing to sit with. Why does walking into one room instead of another change whether a woman lives or dies? Semmelweis starts eliminating explanations. If overcrowding were the cause, the busier clinic should be safer, not deadlier, and it's the opposite. If it were about modesty or the trauma of being examined by male medical students rather than midwives, the timing doesn't fit the pattern of the illness. If it were something in the air of Vienna itself, both clinics breathe the same air, blocks apart. One by one, the accepted theories fail to explain the gap. The answer arrives, unwanted, in early 1847. Semmelweis's close friend and colleague, Jakub Kolečka, is performing an autopsy when a student's scalpel accidentally nicks his hand. Within days, Kolečka is dead, and the disease that kills him doesn't look like an accident. It looks, symptom for symptom, organ for organ, exactly like the fever that's been killing new mothers down the hall. Kolečka never gave birth. He was never in the maternity ward. The only thing connecting his death to theirs is what happened just before it: contact with a corpse. Semmelweis puts it together. The doctors and medical students in the first clinic spend their mornings performing autopsies, often on women who died the day before, of the very fever in question, and then walk directly into the delivery room to examine living patients, hands unwashed. The midwives in the second clinic never touch a corpse. They only deliver babies. He doesn't have a word for germs. No one does yet. That's still decades away. What he has is a hypothesis. Something is being carried physically on the hands of the doctors, from the dead to the living. He calls it cadaverous particles. He doesn't know what they are. He knows they can be washed off. In May of 1847, Semmelweis orders every doctor and student under him to scrub their hands with a chlorinated lime solution before they touch a patient. Not soap and water, which does nothing to the smell of the autopsy room, but a harsh chemical solution strong enough to strip the odor of death off human skin. The results don't take years, they take weeks. In April of 1847, before the policy, the first clinic's maternal death rate stood at over 18%. By June, less than 2 months later, it had fallen to 2.2%. For the first time since anyone had been keeping records, the doctor's clinic and the midwives' clinic had roughly the same survival rate. Semmelweis has done something no one else in Viennese medicine has managed. He has taken an invisible, unexplained killer and made it stop. Using nothing but a bucket of chemical solution and a policy of washing hands between the dead and the living. He doesn't know why it works, not in the terms we'd use today. But the mortality logs don't need him to know why. They just need him to be right. And he is. This is where the story should end with Semmelweis celebrated. It doesn't. His theory has no mechanism the medical establishment of the 1840s can accept. There is no germ theory yet to explain it, and to many of his colleagues, the implication is not just scientifically unfamiliar, it's personally unbearable, that they themselves, respected physicians, have been killing their patients with their own hands. Some accept his findings, many don't. When his contract at Vienna General Hospital comes up for renewal in 1849, it is not renewed. A decision tangled up in professional rivalries, political upheaval following the 1848 revolutions across Europe, and resistance to his theory, in some mixture historians still debate the exact proportions of. Semmelweis leaves Vienna for Pest in Hungary, where he takes a position at St. Rochus Hospital and does it all again, instituting the same hand-washing protocol, watching mortality fall the same way. The evidence keeps arriving. The acceptance doesn't follow it. In 1861, he publishes a book laying out everything: the clinics, the numbers, kolechka, the chlorinated lime, over a decade of results. It fails to change the minds he needs it to change. Something in him breaks in the years after. He begins writing furious open letters to the obstetricians who've dismissed him, accusing them outright of killing their patients through negligence. His behavior grows erratic enough that in 1865 he is committed to an asylum in Vienna. Some accounts suggest he was misled about where he was being taken. He dies there 2 weeks later, at 47, officially from a wound that turned septic, an infection. The same category of disease that had defined his life's work, though the exact circumstances of the injury remain disputed by historians to this day. Louis Pasteur's germ theory and Joseph Lister's antiseptic surgical methods arrive within a few years of Semmelweis's death, and retroactively prove he had been correct the entire time. Today, he's remembered as a pioneer of antiseptic medicine, sometimes called the savior of mothers. His name has even become shorthand, the Semmelweis reflex, for the very thing that destroyed him. The tendency of people, even experts, to reject solid evidence simply because it contradicts what they already believe. He didn't need the 20th century to prove he was right. He needed the 19th century to believe him while it still mattered. It didn't, and the gap between those two things is the whole story.